Good afternoon. My name is Elizabeth Evans. Today I'll be talking about the disorder of schizophrenia. It is a chronic mental health disorder on the severe end of the schizophrenic spectrum. Symptoms involved with this disorder are psychosis, which is like the impaired sense of reality that typically involves both hallucinations and or delusions. We also see some impaired cognitive processes, typically seen in the disordered speech, as well as some disorganized motor behavior, flailing of the body parts, raising of the arms and contorting the body, and then a variety of other behaviors that affect the social interaction person to person. The reason why I chose this disorder is because I feel there are many people in our community that are affected by this condition. We see them on our streets, and many times they suffer in silence, and so I hope to bring awareness to this disorder and also to encourage people that have the disorder or know people who have the disorder to seek treatment to live a meaningful life. Diagnostic criteria for this condition based on the DSM-5, we'll be using code 295.90. The patient must have 2 or more of the following for a significant period of time, and this must include delusions, hallucinations, and also disordered speech. Those 3 things must be in place, as well as grossly disorganized or catatonic behaviors, and then negative symptoms, which include diminished emotional expressions or an inability to start and finish processes. In addition, the level of functioning in 1 or more of the areas of their life is specifically diminished, which includes self-care, being able to work or hold down a job, and then the disconnect of interpersonal relationships. Continuous signs of this disturbance or the disorder for at least 6 months in either an active phase or what we call inactive or just negative symptoms only. Schizoaffective disorder, depressive, and bipolar disorders with the schizophrenic features are not present. So if those things have been ruled out, then we know we have a true schizophrenic disorder diagnosis. The disturbance or disorder is not attributed to any effect of any other medications or substances that may present symptoms similar, as well as any medical conditions that may have symptoms that are similar to the symptoms we see with schizophrenia. So when that has been ruled out, we know it is a true schizophrenic disorder diagnosis. And then the last criteria, if there is a diagnosis of either autism or other communication disorders during the childhood that did not include hallucinations or delusions, then we know we have a schizophrenic disorder diagnosis. Let's talk about assessment strategies. There's many ways to assess this condition. I'll just be talking about 2 ways. Biological. There was a thought that there was just one gene that triggered the onset of this condition, but now we know research says there are many genes kind of working together that put us at risk for this. In addition, there are also environmental issues that play in, such as low birth weight and other complications that we see in pregnancy that increase the risk for this development. Social implications. Many times we think that it's a dysfunctional family that causes this to be a person to be at greater risk for this, but we know that no, it's not so much the dysfunctionality of a family unit, but could be just the maltreatment that a patient experiences within their family or even outside their family. We know that bullying puts a person at greater risk for developing this condition, either peer-to-peer bullying or adult-to-child bullying, as well as the physical abuse. Especially from mom to child. We know that a mother that abuses a child under the age of 12, that person is at greater risk, almost 3 times risk for developing schizophrenia later on. But one thing to make sure that you're aware of as a provider, a mental health provider, is when assessing for social indications, make sure you include the cultural factors, because families are all different, and how cultures in different families see social interactions and even symptoms that present in this condition is not always across the board viewing it as actually being a concern. So always make sure that cultural implications are indicated and evaluated. Treatment plan. There are many drugs out there, antipsychotic medications that help to reduce the intensity of the symptoms. It is not a cure, it helps just to kind of level some things out for patients. Dosage and dosing is really important, so patients have to work with their provider to make sure that the dosages are correct. This many times is a barrier for patients to continue on the medications because they don't go in for follow-ups typically, and also the side effects associated with the medications can be a barrier. Some of the drug therapy that's being used is Halidol, Risperdal, Abilify, and Latuda. In addition to using medications, we also have treatment therapies that involve inpatient therapy or milieu therapy, as we also use that term. This is in a hospital environment, and they just get the support in that community, in that environment, to work with their social skills, taking personal responsibility for their self-care, and just supporting them so that when they transition outside of that community and back into their communities with their families and in an outpatient type situation or therapy processes, they have those skills in place. In addition to those two, cognitive behavioral therapy is also an effective way of managing, as well as support systems that involve counseling with both the family and the patient, especially when the patient comes back into the family unit after receiving treatment inpatient. In summary, schizophrenia is a serious chronic mental disorder. There are various components that feed into or support the etiology of this disorder. Treatment options are available, and as providers of mental health care, I feel that it is our duty to normalize the desire to seek treatment, to encourage people to come in and to receive and seek treatment, and to support them once they get into the treatment process. So this is schizophrenia, and I'm so happy to be able to share this experience and this information with you today. Thank you so much for your attention.